My dear friends, as I have been discussing issues of importance, especially the developmental topics, how these developmental systems need some sort of change in order to make it foolproof and beneficial to society. Today I am going to discuss about a new topic, which is cleanliness, hygiene and sanitation education. The father of our nation, that is Mahatma Gandhi, started this movement long back, and he wanted that everybody should cooperate with him. He himself participated in the cleanliness movement by taking out all the dirt from drains and everywhere so that others are motivated. We also started this movement in different countries by collaborating with our friends from Australia, from USA, from Europe, from Africa, many countries in Asia, in Latin America, way back in 1994. It gathered momentum because we had collaborators. In every country, we had the broadcasting agencies, the national broadcasting agencies are our collaborators. And whatever we and our partner institutions were doing about cleanliness, hygiene and sanitation used to be shown on the television or the radio. So there was a very good experience, and then we designed a curriculum to teach cleanliness, hygiene and sanitation. We also asked more than 1,000 universities all over the world to also include this curriculum as a part of the curriculum of other subjects. If they are teaching medical science or engineering or social science, or for that matter, juridical science, everywhere there has to be a topic. Because cleanliness is one thing which should be known to everybody. God willing, 20 years after we started the project in 1994, so in 2014, the Prime Minister of India, Sri Ranjan Modi, also thought of making it compulsory in this country, in India, by initiating a government movement known as Clean India Movement, Swachh Bharat Abhiyan. Every policy maker, every minister used to participate in the cleaning movement, and that is how it became very popular. Every department, every corporation had been given a milestone and a target to clean up some neighborhood area. We also, under our National Institute of Cleanliness Education and Research, NICER, designed curriculum at the certificate level, diploma level, post-diploma level, postgraduate diploma level, bachelor's, master's and doctorate degrees. Through ourselves and with the help of more than 15 important universities with whom we collaborated, so that they could also house our institution within their campus for running joint degree programs with a view to creating competent cadre of young professionals who will dedicate their life for the cause of cleanliness, hygiene and sanitation education. In cleanliness also, there is a big business. It's not that it's just a jargon. Billions of investment can be made and trillions of collections can be made in every country through cleanliness movement, through garbage collection, by also making organic fertilizer through vermicomposting, by converting garbage into energy, bioenergy. So that way, cleanliness has to be clubbed with the goal to do business. Otherwise, people will think it is social service, and nobody is interested in social service these days. So it has to be defined and explained and introduced in a way that everybody gets used to it. Hygiene is very important. One have to have knowledge about hygiene, to be healthy, to be clean, to wash their hands. Now that there is a pandemic, we have been asked to wash our hands every 2-3 hours. It's a good idea. But we have been asking from before. We have been asking to use mask wherever we feel that there is a risky place to go. But now that it is made compulsory, it is a very good idea. Regarding sanitation also, we have been seeing that no big research was done in order to see that human excreta, or for that matter, whatever the solid waste and sanitation waste are treated well, not only to use energy but to use fertilizers. So the lavatories, toilets are to be made cleaner in order to maintain good health. All these things are to be taught in a capsule course, in a short-term course, in a long-term course, and in the form of a certificate, degree or diploma. It is very important. Why it is important? Because it concerns our health also. It is a health hazard issue. The way hazardous wastes are being produced in the factories and industries, we have to treat them. It will also come under the same cleanliness, hygiene and sanitation. So we have to do the hazardous waste management, hospital waste management. We have to bother about cleanliness, hygiene and sanitation. So unless and until the resident welfare associations, the officials and other staff of the government offices, the staff members of different factories, the staff members of private establishments, private offices, in the village also, at the local self-government levels, this need-based training is provided in the formal or informal or non-formal way. We cannot be sure whether we will be able to reach the grassroots level. This is the only way. Not only we should make teaching of cleanliness, hygiene and sanitation in schools compulsory, colleges compulsory, universities compulsory, every student. And before the students are taught, the teachers must be taught. Once the teachers understand the need, they will come home and teach the entire family member. Only then it spread like a wildfire everywhere in all nook and corner of the world, and then only we will be able to ensure that whatever was planned to maintain cleanliness and hygiene and sanitation has really been achieved. Thank you very much. Let us hope that cleanliness movement gathers momentum. All right.